So first of all, not only talking about low desire, but talking about sexual problems in women, we need to talk about what is a female sexual dysfunction. So we need to ask ourselves, why do women have sex? Because a lot of different psychological factors might impair women's sexual desire. And find out, where do I start my assessment and what this means. That for Ruth, we need to have a life history. How has her life developed? Because there might be something that is a risk factor but doesn't really initiate the problem, because and what treatments do we have for women with low desire? What could maybe motivate you a little bit, because you might change the motivation. And we know that for some women, if they have a different way of having sex, but if you try to work on the couple and maybe change what's happening in the couple, that because women don't have the same level of testosterone, there are two people that are not very driven by biological factors.